Bob, what do you think? Should we be anticipating a recalibration of GCQ and bring back some restrictions? The mayors have already asked, of course, to reconsider yung loosening the restrictions to allow even children. What do you think of all of these developments, especially now that the Delta variant is so high on the minds of everyone?
Well, I think that's a very prudent response, no? Kasi inuulit-ulit naman natin that Delta is really more transmissible. And so it would be very inconsistent, di ba? In the face of that information to insist on doing things business as usual.
So you're saying nang anuhin yung mga bata, na pabalikin na muna sa bahay yung mga bata. Is that what you're saying? Oh, you're a pediatric doctor. Is that your recommendation?
That's been discussed, and so initially the thinking was that the situation was stable, NCR in particular, and other areas with GCQ and GCQ status had decreasing cases, and this was being balanced against the very prolonged interval over which kids had been locked in. No? So it was thought na maybe this would be a good time, but that was like before Delta came into the horizon.
Would that be enough though?
Yes,
if that's the only thing that will be changed for now? No? Because the debate is really whether to do it soon and faster, or whether to do it gradually as the numbers come in, then they will adjust. You know, how should we do it and at what rate?
So you're asking Lucci about the restrictions in general, I suppose?
Yes, yes. The adjustments, yes.
It really will depend on how quickly the cases are detected, how quickly the cases will spread. You know, I think it's really nothing short of a miracle that we haven't had such an explosive increase in NCR, diba? Kasi all of our surges have really been based in NCR, except for this one, which is something of a mystery, but welcome nonetheless, because it gives us time to prepare. And I heard part of your discussion with Dr. Ubial. There's been a lot of movement in the background, just trying to get things ready because we know how bad this can get.
And ma'am,
like what, ma'am?
just to be,
what
not to be...
Hospitals, preparations, no? Yeah.
So actually the preparations that Dr. Ubial mentioned, no, increasing the capacity of the hospitals, the ICUs, making sure the LGUs are ready to receive patients with moderate or rather with mild and asymptomatic cases into their TPNFs, talking about ramping up capacity for testing again, discussing interventions for patients with mild and asymptomatic cases so that they don't have to flock to the hospitals, talking about do we have enough oxygen supply and what should be prepared to make sure that we at least have a fighting chance against this.
But in terms of quarantine restrictions, what should we be doing now ahead of time? I mean, ahead of that potential surge?
I think people should rethink how they move. I mean, regardless of what quarantine restrictions are going to be imposed in the community, I think dapat marunong mag-isip ang bawat individual. Yung ilalabas mo ba today, kung nahawaan ka ng Delta, hindi mo ba isisisi, ipagkasisisi yun. So 'di ba, parang I think we've lived long enough with this for us to know how to behave. So kung ano man yung gawin pa in the community, we still have the freedom to choose to take care of ourselves in a very appropriate manner. Kasama na yung bakuna, di ba?